The concept of universal healthcare, where all citizens have access to healthcare services regardless of their income, employment status, or medical history, has been a subject of intense debate in the United States for decades. While some view it as a necessary reform to address the glaring inequalities and inefficiencies in the current system, others remain deeply skeptical of its feasibility and implications. Below is a detailed examination of the pros and cons of adopting universal healthcare in the U.S. Pros of universal healthcare in the U.S. Prohibitive costs of private insurance or employer-based coverage. In a universal system, the uninsured would no longer face the impossible choice of foregoing care due to financial constraints, leading to broader access to preventative care, chronic disease management, and emergency services. Moreover, universal healthcare would likely reduce the significant disparities in healthcare outcomes that exist today, particularly among low-income groups, racial minorities, and rural residents. These populations are often disproportionately affected by poor health outcomes, not because they are inherently at higher risk, but because they face barriers such as lack of access to affordable care. A universal system could level the playing field, ensuring that all people have the opportunity to lead healthier lives, regardless of their socioeconomic background. Another key benefit would be the potential for improved public health outcomes. In countries with universal healthcare systems, there is typically a stronger focus on preventative care, which can significantly reduce the long-term costs associated with untreated conditions. When healthcare is universally accessible, people are more likely to get regular checkups, screenings, and immunizations, catching health issues early and treating them before they become more complicated and expensive. As a result, life expectancy could increase and mortality rates from preventable diseases might decline. This early intervention would also reduce the overall burden on emergency rooms, as people would no longer wait until their conditions worsen to seek care. Financial protection for individuals and families is another central advantage of universal healthcare. In the current U.S. system, medical expenses are a leading cause of bankruptcy. Many Americans face crippling financial hardship due to high insurance premiums, out-of-pocket expenses, or catastrophic medical bills for serious conditions. Universal healthcare would provide a safety net, ensuring that people do not lose their homes or go into debt because they needed life-saving medical care. By eliminating these financial barriers, people would be more likely to seek care at the right time, reducing the likelihood of health issues spiraling out of control. Another significant benefit of universal healthcare would be its potential for improving administrative efficiency. The U.S. healthcare system is notoriously complex, with a mix of private insurers, government programs like Medicare and Medicaid, and numerous regulatory requirements. This patchwork of providers results in high administrative costs and inefficiencies. In contrast, a universal healthcare system could streamline these operations, reducing overhead costs that currently make up a large portion of healthcare spending. A single payer or public system could simplify billing, reduce the need for multiple layers of bureaucracy, and eliminate the administrative burden for healthcare providers, resulting in cost savings that could be reinvested into the system. Economically, universal healthcare could offer several benefits. One of the most notable advantages is the potential reduction in employer-provided health insurance premiums. In the U.S., employers are often responsible for providing health insurance to their employees, and this can be a significant financial burden for small and medium-sized businesses. By shifting responsibility to the government, businesses could reduce their overall operating costs and workers could gain more disposable income. Additionally, when healthcare is universally accessible, workers are less likely to miss work due to illness, which can improve overall productivity and economic output. Cons of universal healthcare in the U.S. The benefits of universal healthcare are persuasive. Nevertheless, the system would also bring a number of obstacles and downsides that would need to be addressed initially. One of the most significant problems with the implementation of universal healthcare in the United States is the enormous expense. When it comes to healthcare, establishing and maintaining a universal healthcare system would require significant financing from the government. This may be accomplished through the imposition of more taxes or through the reallocation of funds from other government initiatives. There is a potential for a substantial financial burden to be placed on taxpayers, and the magnitude of the investment that is necessary is intimidating. There are estimates that show that the transition to universal healthcare will cost trillions of dollars over the long term. This raises worries about the viability of the transition, given the current level of the national debt and the competing demands for government spending. Furthermore, the shift to a universal system might result in greater taxes, which would be a difficult sell from a political standpoint. The United States of America is currently struggling with growing taxes in a number of different areas, and the possibility of new taxes being imposed in order to support healthcare may not appeal to many people, particularly those who are already paying for private insurance services. It is possible that the willingness of the general people to endure the higher tax burden presented by such a system could be a significant barrier to its implementation. The likelihood of greater wait times for medical treatments is yet another potential drawback associated with universal healthcare. Numerous nations that have universal healthcare systems are confronted with difficulties that are associated with an overworked healthcare infrastructure, particularly in urban regions. Demand may exceed the supply of physicians, specialists, and hospital resources as a result of an increase in the number of people who rely on treatment that is provided by the government. This may result in delays in treatment for operations that are not considered to be emergencies or surgeries that are elective, which may result in a reduction in the timeliness of care. The provision of emergency and urgent care would most likely continue to be a top priority, but the waiting times for elective treatments and specialized care might be extended accordingly. The standard of care may also be a cause for concern in a healthcare system that is universally accessible. It is common practice for universal healthcare systems to reduce the rates of compensation for hospitals and physicians in order to better control expenses. This may result in a decrease in the number of healthcare providers who are prepared to accept insurance that is paid for by the government, despite the fact that it lowers overall healthcare spending. This could, over time, make it more difficult to obtain high-quality medical treatment, particularly in places that are neglected or rural. In addition, the pressure to restrict spending may inhibit innovation in the fields of medical research and healthcare. The United States of America has always been a pioneer in the field of medical innovation. However, some individuals believe that if financial incentives for private corporations and healthcare professionals were reduced, it would slow down the development of new treatments, medications, and technical advancements. The increased control that the government would have over the healthcare system would be another obstacle that would be presented by universal healthcare. Opponents are skeptical about expanding the role of the state in such an important domain, despite the fact that supporters say that a system that is administered by the government may improve both accessibility and efficiency significantly. There is apprehension that a system that is governed by the government would result in inefficiency, bureaucratic red tape, and a reduction in the amount of individualized treatment provided. Certain individuals are concerned that the implementation of centralized decision-making could lead to a one-size-fits-all approach that fails to take into account the varied requirements of various populations, which could potentially result in a decrease in the quality of care provided. Additionally, the United States of America possesses a private insurance market that is deeply rooted, and the implementation of universal healthcare would drastically upset this sector. Many individuals place a high importance on having the opportunity to select their own healthcare plans, physicians, and providers. It is possible that a universal healthcare system would diminish these options, which would give some Americans the impression that their freedom to make decisions regarding their healthcare would be curtailed. Furthermore, a transition of this nature would almost certainly result in job losses in the private insurance industry and other associated sectors, which might have wider-ranging ramifications for the economy. Lastly, universal healthcare could be met with strong opposition from political parties. It is extremely likely that the discussion on the implementation of socialized medicine would be highly heated because the concept of socialized medicine is politically divisive. The United States of America has a deeply ingrained belief in individualism and personal responsibility, and the concept of a healthcare system that is administered by the government is seen as being in direct opposition to these beliefs by many people. A tremendous amount of opposition from both policymakers and the general public would need to be overcome in order to create the political will necessary to implement universal healthcare. Conclusion: the debate over universal healthcare in the U.S. is multifaceted and highly complex. On one hand, it could dramatically improve access to healthcare, reduce disparities, and provide financial protection to millions of Americans. On the other hand, it could lead to significant economic challenges, potential inefficiencies, and a reduction in the quality of care. The high cost of implementation, the disruption to the private insurance market, and the increased role of government in healthcare would be significant hurdles to overcome. Ultimately, the decision to implement universal healthcare in the U.S. would require careful consideration of the trade-offs involved. While the benefits are compelling, the drawbacks also present serious concerns that would need to be addressed through careful policy design and robust funding mechanisms. The U.S. may need to find a balance between the best aspects of private and public healthcare systems to ensure that it can meet the needs of its citizens while maintaining sustainability and quality. Thanks for watching. Don't forget to like and subscribe to our YouTube channel.